So what we're recommending is that we treat all the coughs and colds as potentially coronavirus, and that those children stay home.
What are sort of the key things that a parent would look for to know that I need to get them to the hospital or to the doctor?
Sure. So there are a couple things that are a little bit different about this virus. It does tend to cause higher fevers, although lots of viruses cause fevers. It seems less likely to cause a runny nose. Only about 8% of children with coronavirus have a runny nose, as opposed to other viruses, that's often the very first sign that you see. Children with coronavirus have that really peculiar symptom that a lot of people have been talking about, where they lose their sense of smell. That seems to be something that's very unique to coronavirus, and if we were to see that, COVID would come to the front of our minds.
Getting, your child vaccinated for the flu, would that be a good idea?
We're strongly encouraging that for our patients this year for two reasons. The first is that influenza looks a lot like coronavirus, and it will be very confusing for us if we have two similar looking diseases spreading in the community at the same time. The second is that although coronavirus is not a particularly dangerous infection in children, I really don't want to see a child who has coronavirus and influenza at the same time. I'm concerned that could be a fairly potent combination.
So what would you say to parents now, again, as they're sending their kids to school? What, again, would be the best advice you could offer them?
I think the best advice for school this year is to have reasonable expectations about what a school year is going to look like. I think it would be a success in my mind if your average child spends 75 or 80% of the year in school. But I think every child will spend some portion of the school year doing remote learning due to illnesses that, while minor, need to be kept out of school. That is going to be very disruptive for schools, for children, for parents, for employers. Not as disruptive, I hope, as what we went through in the spring, but something that we'll all be dealing with.
What may appear to be a cold symptom or something, I mean, just don't take a chance. Just keep them home.
The government's exclusion guidelines are really clear on that. So fever and any respiratory symptom required to stay home, not allowed in school.
Just don't take a chance. Keep them home.
That's right.